Our weather is changing, and it could pose an increased risk for seasonal vertigo, and surprisingly, it's among the most common reasons for emergency medical visits during this time of the year. To tell us all about it, we're very pleased to be joined back by Dr. Kurt Belk. He's the medical director and emergency physician with the urgency room. So thank you for coming back.
Thanks for having me.
So what causes vertigo and dizziness with the changing of our seasons?
It's actually pretty simple. The main reason is that this time of year, people tend to be back indoors. Kids are back at school. The temperature tends to drop, which causes our noses to run. We tend to and then touch a doorknob, shake a hand, and it's just spread from person to person by viruses mainly.
And vertigo itself, what is that?
So there are different types of vertigo, but most commonly vertigo is described as an inner ear disturbance. And what happens is that the brain gets different signals from your ear that it has difficulty determining where you're at within your environment. So your brain gets one stimulus from one ear and a different stimulus from another because of its being infected or inflamed. And you get this feeling of spinning or gyration that causes you to have difficulty with your balance, and then other associated symptoms can develop also.
And it does require sometimes going to the emergency room, or?
A lot of people come in because they think they're concerned that there's something else going on more serious than just simple vertigo. And it's difficult for somebody to determine whether it's something that they have to see a doctor for or not. And the recommendation is that you just come in and get checked out to make sure that it's not something more serious like a stroke or something going on inside your brain.
So you can't really tell the difference between them? They have similar kinds of symptoms?
They do. There are certain tests that you can do by doing a really good history, a complete physical, which our previous doctor talked about as kind of a lost art in healthcare today.
Yeah.
But doing that along with some maneuvers, there's a Dix-Hallpike maneuver that you can do that can give you an indication of some bouncing of the eyes, that can give you some determining whether it's from the central portion of your brain or whether it's peripheral and just an inner ear problem.
And what kinds of treatment is there available then?
And again, that depends on the type of vertigo that you have. Sometimes with an inner ear disturbance, you just have to retrain yourself, and your brain retrains itself by going through certain vestibular exercises. And so you concentrate on walking in a normal pattern. You concentrate on slowly getting up and transitioning from lying to sitting and then sitting to standing. Those types of things will help your brain retrain itself so you don't have this issue of the spinning sensation that can be very difficult, especially when driving.
No magic pill that you can take that makes it go away?
Not necessarily. There's certainly treatments that can help with symptoms of vertigo, and there's medications. One is called anti-vert or meclizine. That's an anti-vertigo med that helps just diminish the symptoms and can help you function, and so you can do your day-to-day activities.
Are there certain people that are more at risk for developing this at this time of the year?
Yeah, the biggest risk factor for folks is advancing in age. As we get older, we have less elasticity. The organ in the inner ear that has the fluid, that is kind of our balance area, that tends to be less elastic, and you tend to develop vertigo easier as we age.
It's interesting. I was talking with my hairdresser about that. You were going to be talking about this topic, and she said, oh yeah, she has clients that can't lay down to get their hair shampooed because of this. So I was not aware of that. So what other information should our viewers know about vertigo this time of year, what they should do, anything they could do to prevent it?
Yeah, the biggest thing is just good hygiene. Good hand hygiene, which is good throughout the cold and flu season.
Yeah.
That's going to diminish your risk of getting the infectious causes, which are the most common causes of vertigo. The other thing that you can do is when you get the symptoms that are concerning to you, I would recommend going in and seeing your healthcare provider that can help you distinguish between something that's more serious and life-threatening as opposed to something that's just going to be a little bit of misery for you to have to suffer through.
And if they want some more information about it or information about the urgency room, where should they find that?
You can get that on our website. There's a lot of different websites out there that have good medical information. WebMD also has some good information on vertigo. I actually refreshed looking at that this morning just because people want to hear what they read, and they want to know that what they're hearing and reading are similar from their healthcare provider to what they see on the internet.
Absolutely. Everyone goes right to the internet, don't they, for answers?
They do.
Yeah, I've got a sore throat. It must be something that I can find out what it is. So final comments about vertigo for our viewers.
I think anytime that you have an experience that makes you uneasy, that you feel threatened for, you should go in and get it checked out.
Well, thank you for joining us, and it's always a pleasure to have you with us. Thank you.
Thanks again.